Dalhatu Araf Specialist Hospital in Lafia, the Nasarawa State capital, says it hasn't recorded any coronavirus-related deaths since the pandemic broke out in the country in February. The hospital is one of the tertiary health institutions in the state designated by the government to contain the spread of the virus. Godwin Agwam has more.
Nigeria recorded its first case of coronavirus on the 28th of February 2020. The novelty of the virus created fear in the minds of Nigerians who were uncertain of their fate. In order to contain the spread of the virus, the Nasarawa State government designated the Dalhatu Araf Specialist Hospital (DASH) in Lafia as one of the two centers in the state to isolate and treat patients who have contracted the disease. The hospital has so far treated 173 positive cases in its isolation unit with 0 deaths.
We had all sorts of equipment that we requested for, including ventilators provided by the government, including dialysis machines, all in preparation for the disease. And in terms of the structures on ground, we're able to make available within the hospital 110 beds. And most of the cases actually came here in the state. We have managed 173 cases so far with no death.
Musa Adamu is an aged man and a farmer. He is one of the lucky 173 survivors of coronavirus treated in the hospital.
I was brought in and I was taken to a room that was very comfortable, very isolated. I was alone and the facilities were there, toilet facility was there, the bedding, the feeding, everything. So it was excellent, and at each point I needed drugs. I was administered, and my BP was constantly taken. My temperature was constantly taken, because initially when I was brought, my temperature was so high.
Medical doctors who are frontline workers were also not spared by the virus. Evulaza Haruna is a medical doctor with the Dalhatu Araf Specialist Hospital. He tells us how he got infected with the virus and how to be treated by his colleagues in the hospital.
Some few days after the Salah celebration, so I resumed work. So on getting home, I discovered I started having symptoms like malaria, headache, body pains, bone pains. So after I started anti-malaria, thinking it was malaria. So after a few days, and I noticed the fact that I wasn't perceiving smell, and I also lost my sense of taste. Plus the symptoms, the initial symptoms I was still having the initial symptoms. So I now told myself that something is off. Definitely this looking more likely like a COVID-19. So I informed my head of department, who eventually called the head of isolation center, Dr. Isa, and my samples were taken, and after 48 hours, the result turned out positive.
It is a public knowledge that the coronavirus has no specific cure. But how did the hospital achieve its 0 death record?
Now, for those who have mild cases, treatment is just supportive. So what we did initially when we started here was that we're giving a regimen of combination of antivirals, lopinavir, ritonavir, and azithromycin with vitamins. But with time, we tried to compare that regimen with just ordinary vitamins for severe cases, for mild cases. And we realized that it was almost the same thing. Giving vitamins for mild cases was okay, and probably giving paracetamol and all. But for severe cases, that's where the challenge is. Severe cases is where COVID is the kind of patient COVID kills. And before the landmark trial from the UK of the dexamethasone use, dexamethasone is actually a steroid that is used to reduce the inflammation. We're using hydrocortisone and we're giving Clexane. And these drugs, we're giving them for free.
The physicians attributed their success to the support they got from the state government in terms of provision of health workers' allowances, provision of adequate funds for treatment, and many other ways.
It was federal government that first made the pronouncement, but we paid ahead of federal government. So our health workers were well motivated, and it's one of the reasons why we didn't have any problem.
Many Nigerians doubted the presence of the coronavirus pandemic, But here we are at the Dalhatu Araf Specialist Hospital Isolation Unit, where over 173 patients were tested and treated. At the moment, there is no active case. Godwin Agwan, TVC News, Lafia.